Assalamu alaikum warahmatullahi wabarakatuh. Myself, Professor Muhammad Hassan Farouqi, is going to deliver a lecture today on the valvular heart disease, also known as congestive heart disease. It's a very important topic, I think, useful for both the UGs and PG scholars, and in helping you people in diagnosing the disease clinically by observing the patient also, and by hearing the complaint from the patients. It's very, very important topic. And inshallah, within 4 lectures, we will conclude the cardiology, inshallah. Basically, what is the difference between amphibians and humans? Amphibians have 3 chambers, 2 atria, 1 ventricle, and humans have 4 chambers, 2 atria and 2 ventricles. Right atria here, it receives blood from the superior vena cava, inferior vena cava. Superior vena cava means what is the venous blood? Inferior blood cava is a big cavity. Big cavity, but the radius of the vena cava is a bigger one. Okay, and it is from the upper limb, vena cava, upper limb, neck, and upper part of the shoulder. And inferior vena cava receives blood with thorax, abdomen, whole abdomen, perineum, male and female sexual organ, thighs, and legs, lower limbs, and the calf muscles, and even from the toes up. Okay, right? And this right atria is separated from the right ventricle and through the tricuspid valve. And this is the right chamber. Here you have to see how the how the blood moves from the earth, away from the earth. This is the right atria, right ventricle, tricuspid valve, and this is the pulmonary trunk. And pulmonary trunk divides into 2 pulmonary artery, and one goes to the right lung and another goes to the left lung. Each lung has 1 artery and 2 veins, and right lung has 3 lobes. Right side of the heart has 3 valves. That is the tricuspid valve. In the same way, we will go to the left atria. Interatrial septum is very important congenitally. Interatrial septum is very important congenitally. Why? Because I am saying congenitally. Because there is a fossa ovalis over here. Fossa ovalis over here. And this fossa ovalis is congenitally present and helps in shunting of the blood. Why? Because the lungs are non-functioning in mother's womb. Non-functioning lungs in mother's womb. And this left atria, receives blood from the each lungs, 2 veins from one lung, right lung, and 2 veins from the left lung. And it receives from receives in the left atria, and from left atria to left ventricle to mitral valve. This is mitral valve. Okay, this is the this is the pulmonary circulation. This is systemic circulation. Here, 2 are very, very, very important. And in the immediately we will shift to the next class, inshallah. Immediately. Okay, right. Thank you. Now, like we will continue. This is the mitral valve, and from left atria to the left ventricle, the barrier is the mitral valve. Atrioventricular valve is mitral valve. That is mitral valve, bicuspid valve, or mitral valve. And this section is a pure blood. And you see, these are the pulmonary veins. These are the only ones which carries pure blood. This is the pulmonary trunk. This is the only artery which carries impure blood. Remember it. The definition of the artery is not that it carries pure blood. Definition of artery, the vessel away from the heart is known as artery, and the vessel towards the heart is known as vein. Don't say pure blood or impure. Don't say oxygenated blood or deoxygenated blood. That definition should be very, very accurate in medicine. And remember, this is a very, very important thing in medical practice, that definition should not vary from individual to individual. Now this is this. Now, what is congestive heart disease? What is valvular heart disease? There are 4 valves. This is a 4 into 2. 4 into 2 is 8. Tricuspid stenosis or tricuspid regurgitation. Okay, 2. Mitral stenosis or mitral regurgitation. 2. Pulmonary stenosis or pulmonary regurgitation, and aortic stenosis or aortic regurgitation. There are the congestive heart disease have 2 separate big divisions: inflow obstruction and outflow obstruction. Inflow obstruction means what? Inflow means the blood in the right ventricle it inflowed from right atria. Remember definition. Inflow obstruction means the blood from the right in the right ventricle inflows from the right atria, and the blood in the left ventricle inflows from the left atria. Okay, there are no what you call veins over here. There is no wall flowing the here. There won't be any what you call inflow obstruction over here. Inflow obstruction over here. Very rarely you'll find what you call inferior vena cava obstruction. Very rarely, and in the only in inferior vena cava. You cannot heard. You might not have heard about the pulmonary venous obstruction. Okay, so this is inflow obstruction for the right ventricle is tricuspid stenosis or tricuspid regurgitation, and mitral stenosis and mitral regurgitation. Number one, inflow obstruction is lower. Now the outflow obstruction. Outflow obstruction means when the blood is pumped out from the ventricle and to the connecting vessels. Connecting vessels when the ventricle is what you call when ventricle contract. When the ventricle contract, the blood from the right ventricle and left ventricle simultaneously pumps its blood in the connecting vessels to the pulmonary trunk and out. Pulmonary trunk and out. This is we are talking about the inflow obstruction. Inflow obstruction means the right ventricle, right atria pumps out blood from the right atria to the right ventricle. This is the inflow obstruction in the mitral tricuspid stenosis or tricuspid regurgitation. And this is the mitral stenosis and mitral regurgitation, left atria, left ventricle. And the outflow obstruction means outflow is, remember one thing, outflow is herd outflow. Okay. And outflow is the right ventricle pumps out the blood to the pulmonary tract, and it goes to the right lungs and left lung. This is the pulmonary artery, and these are the only artery, as I told you, that which carries impure blood. And this is the from here. This is aorta. This is the aorta. And aorta carries pure blood and to the nook and corner of the body. And you remember one more thing is that the direct branch of aorta is coronary artery. Coronary artery. Now coming back to the point, what will happen in congestive heart disease? What are the diseases? As I told you that tricuspid stenosis. Stenosis means narrowing. Stenosis means narrowing, calcification of the valves. And regurgitation means the valve moves upward, ulta, upar chale jana, moves upward. It will not go down. And you'll find tricuspid stenosis or tricuspid regurgitation. Now, what will happen in tricuspid stenosis? That's just simple formula. In tricuspid stenosis, blood which is received from right atria, upper superior vena cava and inferior vena cava in the right atria will not pump down the complete blood from the right atria to the right ventricle. Say example, if there is 100 ml blood in the right atria and the whole 100 ml blood should be emptied to the right ventricle through tricuspid valve, and in this case, where tricuspid stenosis or regurgitation takes place, the whole 100 ml will not be pumped out, and the 110 ml, 5 ml will be reduced, and that the residual volume will be 95 to 90 ml is received in this cavity, and 10 ml will be there present, and another 100 ml will come from the superior vena cava and inferior vena cava. That leads to congestion of blood in the right atria. Congestion means staying. And it goes on staying. It goes on staying and creating pressure over the wall. W-A-L-L. Wall of what? Right atria. What will happen if right atria hypertrophies, expands? It will regurgitate the blood to the lower vessels. Lower vessels, what are the lower vessels? Inferior vena cava. Now, this is the inferior vena cava. Resultantly, what will happen? The blood which is coming from the toes, both legs, the patient suffers with pedal edema. Remember this word of pedal edema. Pedal means pair, legs. Bilateral pedal edema is the most important diagnostic point of what you call edema if it starts from the left in a cardiac case. Now, the perineal edema increases from the legs to the thigh, to the perineum, to the abdomen, to the chest, and resultantly, if it completes over here, look at here. If it completes over here, what will happen? The superior vena cava regurgitates. Superior vena cava regurgitates. Here you will find a JVP. Here you will find a jugular venous pulsation or pressure. Pulsation or pressure, it indicates the upper vena cava, that is superior vena cava, is engorged, and it will happen after 4 to 5 years of disease. This is a very, very important point. Remember, the tricuspid stenosis or regurgitation leads to right atrial hypertrophy, congestion of the blood, and congestion of the blood is what we call congestion of the blood, and this will regurgitate in the inferior vena cava, and after completion from the toe to the thigh, thigh to perineum, perineum to abdomen, abdomen to lungs, lungs to heart. And after the completion of what we call inferior vena cava over here, the superior vena cava starts, and superior vena cava, when it starts, it shows the JVP. And there are in the books that JVP is found in right-sided cardiac failure. Okay. Now, after completion of the tricuspid valve, that is tricuspid stenosis and mitral stenosis, and the second part of the heart is the pumping of the blood away from the heart. That is the outgoing obstruction. Outgoing obstruction. Outgoing obstruction means what? The right ventricle, this is the right ventricle, once during systole of the ventricle, systole, C-Y-S-T-O-L-E, systole of the ventricle, it pumps out blood from the, what we call pulmonary trunk to the lungs. Okay. Now, what will happen in right-sided cardiac failure? This, as I already told you, this is what we call semilunar valve. And here, if there is any obstruction, that is the SLV. SLV means pulmonary trunk. Pulmonary trunk means the what we call the pulmonary valves. And what will happen? Pulmonary valves, it either what we call regurgitate, or there is a constriction. As I told you, tricuspid stenosis. Now this is pulmonary stenosis. This is pulmonary stenosis. So what will happen? The simple formula of pulmonary stenosis I will tell you. This pulmonary stenosis, that if say the right ventricle has 100 ml blood and its systole is happening and it has to pump out all the blood to the pulmonary trunk. In case of narrowing of the trunk, in case of narrowing of this valve, EVAL, EVE, what will happen? The 100% of the blood will not pump out, and some amount of blood remains in the right ventricle, and that the amount of blood which remains in the right ventricle is known as residual value. Is known as residual value. And the same amount of blood comes from the right atria to the right ventricle, but 100 ml, 100% blood will not go. And that causes right ventricular hypertrophy. And at the end of the day, what will happen? This right ventricular hypertrophy apply pressure over the tricuspid valve, and this tricuspid valve regurgitate. And as I told you that the tricuspid stenosis, the tricuspid regurgitation, it will regurgitate and it applies pressure over the regurgitated valve, and it goes into the right atria. Again, it goes into the inferior vena cava, and same complaint will be there. Now, the question is how to differentiate by auscultating the first valve or second valve. That is, first valve is tricuspid, and this is known as AV valve involvement, or the semilunar valve involvement. How to diagnose clinically? Now, you have stethoscope. Each and every doctor do have a stethoscope. You just apply on the left side of the heart, chest, okay, and calmly, by closing your eyes, calmly here. Now, I will show you what is the normal sound and what is the abnormal sound. Just hear it. It's very, very important. Close your eyes and just try to hear my sound. First, I will say the normal sound. Second, I will say the abnormal sound. Both abnormal sounds in tricuspid stenosis or regurgitation, in pulmonary stenosis or pulmonary regurgitation, the sounds will be like this. After normal sound, I will say the abnormal sound. Loop, dup, loop, dup, loop, dup, loop, dup, loop, dup. First sound is saw, loop, and long. Second sound, dup, D-U-P, dup, sharp, short. This is a normal sound. Now, here again the normal sound. And after that, you try to see the change in the abnormality and how to differentiate it. I will explain you. Okay, now loop dup 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 loop dup. Now this R is added in the sound. This R is added in the sound. This added sound is known as murmur. And this added sound is known as murmur. M-U-R, M-U-R. Any extra sound in the heart is known as murmur. Now remember, this is a very important point. And if you find a murmur, in the first heart sound, then you can add with the what you call clinical sign of the patient, bilateral pedal edema, raised JVP, If you hear the sound loop with bilateral pedal edema, and in advanced cases, raised JVP, then your diagnosis is confirmed that mitral stenosis is there. Tricuspid stenosis is there. As I told you that the first sound is loop, and if there is an added sound, that sound will become loop. And if the added sound is there, that is known as murmur. Remember? Now, the second heart sound. First heart sound is created by closure of the AV valve. And there should be a simultaneous closure of the tricuspid as well as mitral valve. And that sound is called as lub. And if there is a what you call murmur, it may be tricuspid valve or it may be mitral valve. It may be tricuspid or it may be mitral. And if there is tricuspid, pedal edema is there. Remember, both most important point is pedal edema is there. Now, coming back to the point, how the second heart sound is created and that, what you call added sound is there. Loop, dup, loop, dup, loop, dup, loop, durup, loop, durup, loop, durup. Now, the LUBB, loop is normal, durup, D-U-R-U-P is abnormal, and this added sound is known as murmur. In the second heart sound, when you auscultate over the chair, you will find durup, R, durup, R. R is added sound, that is a murmur. Now, R is created by, the second heart sound created by the simultaneous closure of the semilunar valves. There are two semilunar valves. One is the aortic, another is pulmonary. We don't know which valve is involved. But clinically, we can say pulmonary. If the pulmonary valve is involved, the sound will become durup. And if the pulmonary valve is involved, pedal edema will be there. Edema start from the legs. Edema start from the legs and it comes up. It comes up to the legs and what you call thighs and the perineum, abdomen, and thorax and SOB and all those things. Not SOB, JVP rest. JVP will be rest. Now this we have completed the right side of the heart. Now left side is very, 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 very important. Left atria issues the pulmonary veins. Each vein, there are 4 veins in the left atria. 4 pulmonary veins in the left atria. Each lung carries 2 veins and it vents blood through the left atria. Okay, right? And it's a pure blood. This is the only one which carries pure blood. I have given the definition that a vessel which comes to the heart is known as vein, and a vessel which going from the heart is known as artery. Going from the heart is known as artery, and coming toward the heart is known as vein. Now, this has what you call left atria, left vein separated mitral, that is the bicuspid valve, and the left ventricle is the exit of the blood. Left ventricle is through aorta. And aorta has semilunar valves, and this has the mitral valve. This is the AV valve. These are the AV valves. Now, what will happen? The same story. If there is what you call, if there is a mitral condition or a constriction, and there is a mitral stenosis or regurgitation, what will happen? The left atria, which receives from the pulmonary veins, will not drain the blood completely to the left ventricle, and that leads to what you call, stasis of the blood in the left atria, and stasis of the blood goes on counting. and goes on increasing. And this stasis of the blood regurgitate to the pulmonary veins. It's very important. Regurgitate to the pulmonary veins, and from pulmonary veins to the lungs and interalveolar septum. Interalveolar septum, and that leads to exudate. Not exudate, transudate. And transudate where? In the lung spaces. In the lung spaces. That's the alveoli, and that leads to SOB. That leads to SOB. And this SOB is a very, very particular one. There are 3 to 4 terminologies related with SOB. Shortness of breath on exertion, DOE. Dyspnea on exertion, orthopnea. Orthopnea means if a patient lies on the bed, the patient will feel shortness of breath. Immediately he lifts himself and he goes to the window and he tries to open the window and take on respiration, inhalation and exhalation. This is known as dyspnea on exertion, orthopnea. Orthopnea means bone. A particular posture causes dyspnea. And this is also known as the labored breathing. Labored breathing. For the person who suffer with what you call this type of and if they're suffering with this type of illness, cardiac problem, and the patient feel respiratory distress, and for him, I will show you, I will give you the example, beautiful example, and you say a person, I will continue. Okay, I'm just continuing the point that a patient who is suffering with left-sided cardiac failure will suffer with orthopnea, dyspnea on exertion, labored breathing. And labored breathing, I will give you the example of labored breathing. For example, I'm just living in the farouqi area. A patient comes to me and he says, "What's your name? आपका नाम क्या है?" मैं अभी फारूqi से चलते हुए आरो मैं थोड़ी देर के बाद आपको अपना नाम बता दो. What is this word? Sentence क्या था उसका? मैं अभी फारूqi से चलते आ रहा हूँ, अभी थोड़ी देर के बाद आपको अपना नाम बताता हूँ. So while for him, either he inspires or take respiration or say anything. He cannot walk. He cannot sleep. He cannot even take rest. Postural what you call, orthopnea will be there. Postural orthopnea will be there. Labored breathing, dyspnea on exertion, and the most important point, which one should not miss it, P&D, paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. These 4 things. P&D, orthopnea, and dyspnea on exertion, labored breathing. This is a very, very important point, very, very important topic. Each and everyone should know, and don't try to do the or nebulization to such patients. That's very, very important. And we do the mistakes of giving nebulization to such patient also. And nebulization कब देना चाहिए? Dyspnea on rest. Dyspnea on rest के माने क्या है? अब रेस्ट पे है आदमी, तभी भी डिस्निया हो रहा है उसको एलर्जी हो सकता, ब्रोंकाइट लंग्स की वजह से हो सकता, और किसी और की वजह से हो सकता. Then only we can give prefer. Now this is the what you call mitral stenosis and mitral regurgitation. Regurgitation of the blood to the pulmonary vein. Now what will happen about the outflow obstruction from the left ventricle? Outflow obstruction. This is the left ventricle here. This is left ventricle, and outflow is pulmonary. और इस बॉडी को दिस वन aorta कि में क्या था, कौन सा वाल्व होता? सेमिलुनर वाल्व होता. एंड aorta की जैसे पल्मोनरी स्टेनोसिस हुआ था, यहाँ aortic स्टेनोसिस होता. और aortic स्टेनोसिस के बाद क्या होता? aortic स्टेनोसिस के बाद यहाँ का जो ब्लड है जो लेफ्ट वेंट्रिकल में आएगा. Now this is the most important point. The left ventricle wall is very, very thick. This left ventricle wall is very, very thick. This wall is very, very thick than compared to the right ventricle wall. Okay, this wall is very, very thick, and it will not the right ventricle hypertrophy होता ना, वैसा LVH बल्कि होता है, लेकिन very rare होता है. Okay, right? Now it applies pressure to the mitral wall. It regurgitates. The blood will flow into the left hand here, then will flow into regurgitate into the pulmonary veins, एंड पल्मोनरी वेन से जब रिगर्जिटेट होगा तो वो क्या होगा, लंग्स में जाएगा, लंग्स में जाने के बाद एल्वोलाई के इंटर एल्वुलर सेप्टम में जाएगा, और एल्वोलाई का एक्सपेंशन जो कंट्रैक्शन और एक्सपेंशन होगा वो नहीं हो पाएगा, और एल्वोलाई का जो स्ट्रक्चर है, सेलुलर स्ट्रक्चर है, वो डैमेज होगा, जिसकी वजह से क्या हुआ, सेम प्रॉब्लम, dyspnea on exertion and paroxysmal nocturnal dyspnea. Now what will happen? Same phenomenon will happen when you auscultate, and you say loop dup, loop dup, loop dup, loop dup. Now first heart sound is broken. Now we don't know that it may be due to tricuspid stenosis or mitral stenosis. Now the patient complains of shortness of breath, patient complains of orthopnea, patient से मैं नीचे झुक के उठा तक मेरे को दम चढ़ कर आता, मैं 10 कदम नहीं चल सकता, मैं सीढ़ियाँ चढ़ने नहीं आता मुझे, तो ये व्हाट इज दिस, सीढ़ियाँ चढ़ने नहीं आता, सीढ़ियाँ चढ़ दम चढ़ना, दैट इज नोन एज orthopnea और dyspnea on exertion, dyspnea on exertion. अब ये जो exertion होगा, dyspnea on exertion होगा, अगर ये जो exertion होगा, अगर ये मतलब aortic stenosis की वजह से हुआ तो सेकंड हार्ट साउंड ब्रेक होगा, और मेट्रल स्टेनोसिस की वजह से फर्स्ट हार्ट साउंड. मैं अभी फर्स्ट हार्ट साउंड के बारे में एक्सप्लेन करूंगा अभी आपको. फर्स्ट हार्ट साउंड लुप डुप लुप डुप लुप डुप लुप, फर्स्ट हार्ट साउंड ब्रेक हो गया. और यहाँ पर हमने ट्राइकस्पिड स्टेनोसिस में देखा था पिटल एडिमा, P फॉर पिटल एडिमा एंड P फॉर pulmonary edema. Pulmonary means lungs. Okay, right? And here bilateral pedal edema दें या bilateral pulmonary edema will be there, दोनों लंग्स में होगा, और शॉर्टनेस ऑफ ब्रेथ होगा. यहाँ पर pedal edema शाइनिंग का लेग्स था, यहाँ पर